Consultation is a very important part of your service. It is going to determine if your client is a candidate, if there are any contraindications or precautions. It's going to help you speak to their desire for how they'd like their service to look at the end, so what kind of brow design or eyeliner, but also it is very important from a legal standpoint. And we're going to discuss the consultation form that we gave you an example of in your manual, but just realize and know that your own insurance company will also have forms that they might require you to use, and they will be very similar to this, but definitely do whatever your insurance company or your legal advice, whoever they are, whatever that is that they tell you to use, then that's what you should go ahead and have your client fill out. They need to sign each page, you need to sign each page, and you need to hold on to these documents. These are legal documents. And as much as we'd like to think that our clients wouldn't sue us or anything like that, it happens, it does happen. And we need to be prepared and we need to be covered. That said, by doing a good consultation, doing our due diligence, we can really make sure that we are giving our client the safest and best session that we absolutely can. So one of the things that you will need to cover in the consultation is the health history. And the health history is something that will help you determine not just contraindications, but also things that might be precautions or advice that you might need to give your client. So the consultation form that we actually are having you look at, and it's the one that we use in our studios, is very comprehensive. And the first part of it is going to collect their contact information, and obviously we want this for not just legal reasons but for marketing reasons. There is then going to be an area to talk about allergies, and while we don't typically patch test pigments for clients because they do overall have a very good history of safety, if someone does have a lot of allergies, you may want to consider recommending they come for a patch test, but that would have to be about 48 hours prior to the service. So if you're seeing clients from different states or from hours away, that might not always work out well for them. Some of the other allergic reactions to be aware of with the treatments, and you'll see this on your form, if they have an allergy to lidocaine, for example, that is going to contraindicate the service unless they are willing to do the service without anesthetic, which would be fine for microblading, but would probably prohibit the other services. If they are sensitive to lanolin or Vaseline, those are very often in our post-care products as well as in some of our numbing products. So be aware of that. And then glycerin is often a carrier base in pigments. So you'll need to make sure that you are not using a glycerin-based pigment on your client if they have that sensitivity. I've had a lot of people ask me why crayons is on this list, and that is because we use wax pencils to draw the design, and of course it's the same type of wax that is in a crayon. If we cannot use the wax pencils, we can go ahead and we can design with one of our surgical markers or one of our ink pens would be just fine. Latex, not so much of a concern anymore because we typically wear the nitrile gloves. Have they ever had a cold sore? If they are coming for a lip service, absolutely, when they schedule the appointment, you need to find this out, because if they're having a lip service, they need to be pre-medicated prior to the service. And those who are prone to herpes simplex outbreak, even with medication, will very often find that they do get a flare-up. It's uncommon to have a herpes outbreak in the eye area or the eyebrow area that is triggered from permanent makeup. However, that is always a possibility. So in general, it's just a good idea if they are prone to cold sores that they are pre-medicated or possibly using lysine, which they can pick up at the health food store. In the health category, predominantly these things are going to fall into categories of complete contraindication, precaution as far as they might bleed easier, or they might faint on you, or something of that sort of thing, or they might actually not have good retention. So the Retin-A in the last 2 weeks, as well as currently or having chemical peels or using any type of alpha hydroxys, those things really come down to the integrity of the skin. So if their skin appears to be healthy, it's a healthy thickness, there's no sensitivity, peeling, anything like that in the brow area, it's fine to go ahead and treat them. However, those people do have to realize if they regularly do those things and use those products, they are going to have less length of time that their pigment is retained because of that product use. Trichotillomania is where they pull their eyebrows out, they sometimes pull eyelashes out, and we'll often see clients who've had that disorder come in. However, we have to check and make sure that that disorder is under control. We do not want them picking and pulling on the scabs on their brows or eyeliner, or lips for that matter. That can be catastrophic and cause infection and scarring. Hemophilia is a blood disorder, and you'd very rarely have somebody come in, if at all, with something like that. Liver disease, it's going to depend. If they have hepatitis, they are contraindicated to having the service. Thyroid disturbances are going to lead to problems with pigment retention. It doesn't matter if it's hypo or hyperthyroid. Pigment may not retain as well, and they might need a third session. So just make sure that they are aware of that, that it would be an extra fee for them if they do need that third touch-up. And it's about 50-50 when it comes down to it. Hair loss, why do they have hair loss? Is it alopecia? Was it from some form of chemotherapy or some other illness? Again, with chemotherapy, they cannot be having chemo or radiation. When you do the service, that has to be completed. Otherwise, their skin isn't going to be in optimal health. With anemia, the only problem we run into there is if you are using iron oxides in your pigments, the body will tend to pull the iron out and you'll get some retention issues. Now, epilepsy, if they have someone that they can bring along with them, so someone who can be there who knows how to handle a seizure should that happen, that would be fine. However, we can't have someone in on their own with epilepsy. That would be a contraindication. HIV, we treat everybody if they have like they have HIV. So we're wearing our precautionary gloves and our masks, and we have gowns available. So that really isn't a problem. However, that is a suppressed immune system that you are dealing with, which means they could take longer to heal and might not heal as well. Cancer, they have to be finished with treatment. Obviously, if you had somebody who was terminal, you could get a doctor's note and that would be okay to work on them. Hepatitis we discussed already. Sensitivity to cosmetics. This is going to affect more pre-care and post-care that you use on them. Now, if they have an artificial heart valve or if they have to be pre-medicated with antibiotics before they go to the dentist, then they would need to be pre-medicated with antibiotics prior to having this service done. It's usually individuals with any kind of implant, hip implant, knee implant, heart, surgeries and things like that. If your client is prone to fainting spells or dizziness, just know that laying flat for a length of time can kind of contribute to that. So you may want to, in the very beginning when your services take longer, let them sit up for a minute, bring them some water, and then definitely at the end of the service, make sure that you don't just have them sit up and stand up right away. Let them get their bearings, and again, bring them a glass of water. Are there any tumors, growths, or cysts in the area that you're going to be working on? We cannot cut into moles, warts, little growths, and things like that. And also, is it anything that would contraindicate us actually doing the service? So is it something that could potentially be a skin cancer, or you know, anything that would inhibit us or prohibit us from doing the treatment? Keloid scars and scarring easily. Now, with keloid scars, we discussed it during the Fitzpatrick skin type portion of this class. But basically with keloids, it's an overgrowth of scar tissue that will continue to grow, and they become very ropey, very painful. If someone has a history, they have to think very carefully about whether they want to go ahead with this procedure. It may be something that they opt to not do. But if they do, you have to have them sign off additionally on the consultation that they do realize that because of their keloid history, they could keloid on the face, and they do not hold you responsible for that. And with the scarring easily, someone who scars easily or scars hypertrophically, meaning they get raised scars, they're actually going to do better with machine work than they are with microblading. Microblading causes much more scarring, is much more damaging to the skin. Prolonged bleeding, and you bruise or bleed easily, we just need to know this. We will be ready for that. And have our TAG 45 with the epinephrine. And with bruising, we just have to let them know, especially say with eyeliners, that yes, they probably will bruise and that it's normal and that it will go away. With low blood pressure, they're prone to fainting. High blood pressure, they bleed more. And those are the two big issues there. Now with healing problems, do they just heal slow, or do they actually have diabetes or some form of immune system disorder that inhibits their healing? We don't want to work on somebody who is insulin dependent, and we don't want to work on somebody who has any kind of disorder where they could potentially end up with a wound that doesn't heal. Botox and fillers, fillers predominantly on the lips, and they might just find that the pigment doesn't take quite as evenly as they have if they have a lot of filler in their lips. And then with Botox, usually that is going to be in the forehead and eye area. If they are having their brows done, have them done before they get their Botox, because Botox can cause some unevenness in the brow area. And we want to make sure that we don't design brows for them while they're Botoxed and then it wears off and now they are not symmetrical. And then last but not least, if they are currently pregnant or nursing, they cannot have the treatment. This is according to our insurance, but also just from a safety standpoint, we don't want to be introducing anesthesia and pigments and things into the skin when you are pregnant or nursing. The rest of this front page is going to really be for consultation as far as the design of the brow. There also is an area there for you to document the different blades, the different cartridges, the different pigments that you used. Oftentimes we're modifying colors, we're blending colors, and trust me, you are not going to remember what you used on each client. So make sure to document that. And then there is going to be a intake form page that discusses the anesthetic and the topical anesthetic, anything that could go wrong with that. Make sure they read that over. The top portion is some pre-procedure advice. You may want to actually copy that and send that out as a text or an email so that they can take advantage of that. But basically it's no aspirin, no Advil, no acetaminophen. We don't want them drinking any alcohol, and we don't want them to be drinking too much caffeine before they come in. All of those things are going to dilate the capillaries and cause more bleeding. And then it just reiterates those things that are absolutely contraindications. And so that if they didn't catch it on the first page, they will hopefully see it on the second. Then we have an informed consent for permanent makeup, and they will need to fill in their name and initial where highlighted. And this really, again, is just telling them everything that could possibly happen. It's what has to be done from a legal standpoint. They are going to agree to waive a patch test or not. And then they are going to sign and date it. And then one thing that we do add here at our studios is we have a standard tattoo release form. This is necessary in Minnesota because permanent makeup falls under the category of body art, the same category that tattoo does. So the one thing that you'll notice on it is that it's going to ask for the location of the body art. Just know that that is part of standard tattoo release. And so if it's microblading, it's the eyebrows. If it is an eyeliner, it's the left and right eye. So very simple to fill that in. And then last but not least, we have a photo release form. You must have before and after photos from your client. They do not have to agree to let you use their photos for your portfolio or social media. And if they desire that you don't, you'll write that on the photo release. They'll initial it and you'll initial it so that doesn't happen. However, they have to agree to before and after photographs. If they don't, then they cannot have the procedure. You need those for legal reasons. Oftentimes they will forget what their eyebrows looked like before. I personally had someone who thought that I gave them hyperpigmentation on their forehead, and I was able to show her the before picture where she had the hyperpigmentation already. She probably was just seeing it now because she had these great eyebrows, but little things like that, it's very important to have those photographs in place and have this released signed. And then the one last thing that you'll discuss during your consultation is their aftercare. Now you have to have an aftercare form that you actually give to them. You need to verbalize it, but you also by law need to give them something to take home. And essentially it is going to have how you would like them to take care of the eyebrows, the eyeliner, or the lips. You'll be able to read this over, but very simply with the eyebrows, the first day we want them to blot the brows so that they don't get a buildup of serum and blood, which can create a scab, and scabs are the enemy of pigment retention. And then for the day 2 to 10, we're going to have them wash gently using a mild soap, blot dry, and put on some of the ointment that we give them. And A&D ointment is fine to use. You can also purchase ointments from different permanent makeup companies and put together a little kit. Then at the very bottom, it is going to have for the next 7 to 10 days, and really going on, quite honestly, up to 30 days, to be avoiding saunas and swimming. Water is the enemy, sweat is the enemy. We really want to keep those brows dry. Same with the eyeliner. With the eyeliner, we don't want them in the shower getting that liner wet. You can purchase little shower shields that you can give them to use. They can put some extra Vaseline over their brows or eyeliner before they get wet. But essentially, the more wet they get those areas and they stay wet, the poorer the retention and healing is going to be. And then last but not least, with lips, they're going to want to apply ointment every hour for at least the first 3 days to keep those lips nice and moist. And so they're more comfortable. And then other than that, there really isn't much care. If they do get a cold sore, if they get a little bit of an outbreak on the lips, we'd recommend discontinuing the ointment, cleansing with an antibacterial soap such as Dial, and then letting the lip actually dry.